It's Senator McGrath's time, so Senator McGrath, you go, please.
Thank you. I've got questions to the TGA also in relation to vaping. How many authorised prescribers for nicotine vaping products are there as of today's date?
Okay, well, thank you, Senator. As I've advised earlier, the term authorised prescriber is frankly highly misleading because any of the 130,000, I think we heard from APRA earlier today, any of 130,000 registered medical practitioners in Australia can prescribe nicotine for vaping. What an authorised prescriber can do is prescribe for any number of individuals, therefore, it sort of simplifies the process. Now, as of the 15th of October, so these numbers unfortunately are almost a month out of date, there were 1,353. So I would guess there's probably about 1,400 to 1,500 by now. But I've got this special authorisation to prescribe for any number of patients in Australia.
Okay. In February this year, I put a question on notice asking what engagement the TGA had with social media companies around the unlawful advertising and supply of nicotine vaping products. And your response said that you'd had preliminary discussions with Facebook. Have you since engaged with any other social media platforms?
Oh yes, the engagement, in fact, it was not on nicotine, but on melanotan, which is quite a dangerous tanning product promoted on social media. We have very close relationships with all the major social media groups, whether it be Alphabet, whether it be Facebook, whether it be TikTok, and I'm sure I've left a few out. So we do three things with them, Senator. Firstly, we identify the sorts of products that we ask them to flag and to use their algorithms to block with keywords such as nicotine or melanotan or bodybuilding, or you can imagine. Now, those keywords aren't foolproof because there's other words that are used by people to get around it. The second thing is we flag suspicious or worrying posts to them, and generally they take them down. The third thing we do is we meet with them every couple of months to talk about compliance priorities.
Okay. On your website, you state that TGA 110, which I understand to be the standard for nicotine vaping products order 2021, you state it'll be reviewed 6, 12 and 24 months after its implementation. It's been 13 months since implementation and I understand no reviews have been released. Can the TGA provide details of what reviews are currently being undertaken and
Yes.
how the reviews are being conducted, and can the TGA also provide a breakdown of when these reviews will be released?
So, Senator, this has been an active area of discussion with the Minister and government ever since the May election. And indeed, a range of things have happened, including on the 30th of September, Minister Butler convened a round table of vaping experts to discuss potential requirements for policy and regulatory reform. So in a way, those consultations, and he has also given a commitment to public consultation on possible reforms, and he's also given a commitment to consultation with states and territories and healthcare professionals and community groups. So that process has actually supplanted the idea of getting an independent group of academics to review the process. There's a view by government that the urgency, the dramatic increase in youth vaping needs to be addressed with a matter of urgency. And so currently the plans for next steps are before the Minister, and a decision hasn't yet been made of exactly what will happen when.
So who was on the round table? Sorry, can you state who was on the...
I'll take the full list of attendees on notice. I imagine they are public, but we may have to seek their consent through the Minister for their names to be released.
Sure. And since I last asked the TGA back in February also, and it was a question on notice, it's SQ 2200180, have there been any further discussions between the TGA or the Department of Health with the Department of Home Affairs about the volume of disposable Chinese-made vaping products reaching Australian shores and into Australian schools?
There have been. It is a major problem. And again, one of the things that will be considered by the Minister is whether there need to be further changes to the approach taken at the border. But as I say, that is current. All these things are before the minister to look at what steps he wishes to consult with the states and territories, consumer groups, healthcare professionals, and the public on in the coming months.
Thank you. And I asked a question on notice also back in February, and it was SQ22 000173, that the TGA stated in its reply, testing for prohibited ingredients is not performed if the product does not contain nicotine. Of the 126 products where nicotine was detected, 42 products, 33%, were found to contain one or more prohibited ingredients. Of the 126 products that were found to contain undeclared nicotine, 22% of these products originated from China, 0.8% originated from Hong Kong, and the remaining 77% were of unknown origin. So I think we can take from this answer that of the offending products where country of origin was stated, 96.5% came from China, and of those 126 products, 39% contained at least one prohibited ingredient. So I'm just going to assume, and please correct me if I'm wrong, that all of these products were disposable nicotine vaping products and came from a handful of Chinese manufacturers, Gunpod, iGet and HQD, the same vapes that keep turning up in schools. So if we know that China is accounting for over 90% of offending products and roughly 40% contain harmful ingredients, why not just ban the importation of Chinese vapes, or at least ask the Australian Border Force to set them aside for the testing before they're released?
Well, as I've indicated, measures on, for example, on whether the requirements of TGA 110 should be strengthened and whether there should be further actions at the border are under consideration by government. So I can't comment on particular policy options, Senator.
So you also stated in the answer that you don't test for prohibited ingredients where nicotine is not detected. Well, and you may have touched on this, but who then is responsible for testing those products for prohibited ingredients?
We base our testing on intelligence. So as you've indicated, we've found a number of prohibited ingredients in certain vaping products, but the initial screening that we carry out is where we suspect there may be nicotine, even though it's been hidden or not declared. So we don't have a blanket approach, it's intelligence-led. Our resources do not permit us to test every vaping product for every potential ingredient, and so it does have to be driven by even such things as mining the dark web, looking at internet, looking at social media, looking at prior testing, and looking to other countries, including Interpol. So we gather a lot of intelligence, and that has to direct our testing because we just don't have resources, and I doubt anyone would, to test every product for every substance.
But I suppose where I'm coming from, if prohibited ingredients such as Diactel are exponentially more harmful for people than nicotine, does the fact that the TGA has no interest in testing for the more harmful and banned ingredients make this regulatory regime self-defeating?
No, I didn't say that. I said we use intelligence. And so the same way, even with a prescription medicine, if we've got intelligence that it's a reputable supplier, and you've talked about some companies having a particular risk, if it's a reputable supplier, we are less likely to chase those other ingredients if we've found earlier that their products, or others globally have found that their products are free, for example, diacetyl. And of course, the concentrations make the toxicity. So as I've indicated, it's intelligence-led, merely because nobody has the resources to test every product for every substance. And the same applies for prescription medicines, never mind vaping products.
Okay. One more minute, Senator McGrath.
Okay. I suppose, why should this not sit with a regulatory body that has regard for the safety of all products rather than those that just contain nicotine? Surely the ACCC is better placed to run this than the TGA, because I'm concerned that there's such a narrow scope in relation to the responsibilities in terms of the testing of these products.
So TGA only has a legal remit for when products are therapeutic goods, either medicines or medical devices. Under Australian law, a non-nicotine containing vaping product is not a therapeutic good. Now, government is considering what it should do about the regulation of non-nicotine containing vaping products. And as I've said, however, the deliberative process prior to a consultation is underway, Senator. So, and of course, it is up to government what agency is responsible for what function.
I do have more
Leave the call
questions, but
on.
anyway.
I'll try and come back to you, Senator McGrath.